I'm here today with epidemiologist Bonny Specker, who is going to give us an update on what has been happening over the last week with COVID in our nation, in the world, in our region, and locally. Bonny is also going to talk to us a little bit today about some of the new variants that are in the area and why that matters. Bonny, can you tell us a little bit about these variants and what's happening with the situation?
Okay, thank you, Chelsea. I thought it would be good to talk about the SARS-CoV-2 variants this week, since the Department of Health issued a press release a couple days ago, noting that the Brazilian variant, what we call P1, was detected in Pennington County. So I wanted to talk a little bit about these different variants and why they're important. There is a U.S. government interagency committee that has come up with 3 definitions of these variants. There's variants of interest that they're just sort of watching, variants of concern, which I'll talk about more, and then variants of high consequence. Now, the variant of interest is where there's a genetic change in the actual SARS-CoV-2 virus that affects either the transmission, which is how easily transmitted the virus is, or it might affect diagnostics, like do the tests that we currently have detect this virus, might affect the therapeutics or how, what drugs are being used to treat the virus, or it could affect the immune escape, what we call immune escape, which is, does the vaccinations or the vaccines working? Is the natural immunity? So if you think about these viruses and transmission, diagnostics, therapeutics, and the immune escape, is the mutation in this virus affecting those 4 things? Now, variants of interest, there are some genetic changes that might affect one of those 4 areas, but it's of limited prevalence in the US, and the effect doesn't seem to be very large. So they're of interest, they're watching them, but they're not real concerned about them at this point in time. Then we have variants of concern, which I'll talk about in a second, and then we have variants of high consequence. And these are the ones that we really do not want. They are the ones where you have significant increase in transmission. We can't test for them anymore. They've mutated so much that the tests we have aren't picking them up. And the drugs that have been developed to treat COVID aren't working anymore. The vaccines are not effective against them, and there's a more severe disease. Right now, there are no variants that have been put into this category of high consequence. The ones that we've seen are variants of concern, and this lists the ones that they're currently watching. We have the B117 variant, that's also known as the UK variant. And this is what's happening in South Dakota. There have been 64 of these variants detected in 17 counties in South Dakota. And that includes Brookings County, and we'll get back to this in a second. And with this particular variance, we do have increased transmission. That means it's easier to be spread from person to person. There's minimal effect on therapeutics. So the drugs that we have to treat COVID will work against this variant if that's the disease that you end up getting. And there is some evidence that the disease severity for this virus, this variant, is possibly increased or likely increased. Now, there's another one, the B1.351, which is the South African variant. Only one of these has been detected in South Dakota, and it's actually was in Brookings County. You have increased transmission. There is a moderate effect on the treatments that you can use for the COVID of this with this kind of variant. And it's not really known yet whether or not it affects the disease severity. Then we have these 2 variants, 427 and 429, that are out called California variants. 11 of those have been detected in multiple counties throughout South Dakota. I can't tell which counties they've been detected in. I know Roberts County is one of them, but whether Brookings is also in that isn't known based on the information that's posted on the dashboard. But there is increased transmission and there is moderate to significant effects on therapeutics. So the drugs that we have don't seem to work very well at all with these particular variants. Then we have the Brazilian one. This is the one that was just detected this past week in Pennington County. It's really unknown about the transmission effect. It does have a moderate effect on the therapeutics, and the disease severity is unknown. This is the virus that is the main virus in Brazil, and it has, Brazil has seen a huge number of cases and deaths, but whether or not it's actually due to that particular mutation, the increased number of deaths isn't known. One of the things that I wanted to mention is that these variants are not tested for in every sample. So what happens is just random samples are pulled and tested for the variants. So we don't even know, based on the information that's currently posted on the dashboard, how many samples were actually tested to come up with these numbers. So there's really no way of estimating how prevalent these variants are within South Dakota. All we do know is that they're present, and if they're picking up these variants, it's likely to be more widespread than what these numbers suggest. And they are increasing the number of samples that are being tested. I think right now it's something like 100 samples, 150 samples throughout the state. That's just what I've heard. I'm not 100% sure on that. But I think they are working on improving the reporting of these variants by county, they being Department of Health. This ties back to vaccinations because it's really important to get people vaccinated as quickly as possible for two reasons. The faster people are vaccinated, first, there's likely to be less spread of these variants of concern. If people are vaccinated, they can't be transmitting the viruses. But also, just as important, if not more important, is there's less chances of new variants being formed. We don't want new variants of concern. We don't want mutations that then lead to the variants of significant concern. And a couple things to remember about the vaccines: they are safe and effective, and they're working. If we look at the number of deaths in South Dakota, we have had a pretty constant number of cases. Hospitalizations are up a little bit, but the death rate is down. So, the vaccines, you still may get COVID, but the severity of the disease is reduced. We need to get herd immunity, and the way that's going to happen is through, hopefully, vaccines and not people getting sick. We've always said that you need greater than 70% of the population to be vaccinated, but with these new variants, because they can be transmitted so much easier, that herd immunity may actually be higher. It may be up closer to 80%. Another thing to remember is that if you tested positive for COVID in the past, it's not clear how much natural immunity you got from that and how long that natural immunity lasts. So the vaccine is really an insurance policy against your or helping your natural immunity. So that I just wanted to bring some of that information up about.
Well, thank you, Bonnie. It's interesting to know a little bit more of what we do know about those variants. Like you had mentioned, some of that information is unknown, and hopefully, time will tell as they study these variants more and gather more information about them in general. So thank you so much for that update. Now, what has been happening in the Brookings area and in the state with COVID-19, and even further than that across the world and in our nation?
Sure, Brookings is actually looking a lot better. Right here is the number of cases last week, and this is the number of cases this week. So, we jumped quite a bit last week while we're back down almost to where we were the week before. We've had over 4,000 cases, 78 this past week compared to 141 the week before. We're still way above substantial spread. So hopefully this will continue to get down here below moderate spread as vaccine people become vaccinated. If you look at the hospitalization data, we only had 2 admissions last week compared to 3 in the prior week. So there have been a total of 148 people hospitalized. So if you look at South Dakota, we've been holding pretty steady, between say 1,100 and 1,400 since back in February. And it would be good to really get this also below substantial spread. And that hopefully will happen with the increased vaccinations. The hospitalization for the state, we currently have 115 people hospitalized. This was as of Wednesday. 26 of them are in the ICU. So it hasn't changed a lot in the last week. We had 93 admissions this week compared to 81 the week before. But if you look at the deaths, they are down. 6 deaths this last week compared to 10 in the previous week. So hopefully that will continue to decrease as well. And this is the updated vaccination data as of Wednesday. If again, Brookings is running higher than the state except for this age group, the 20 to 29-year-olds. And if you look at the whole state, and all of Brookings County, we both have 49% of the population vaccinated. That's 49% of those aged 20 and up. And the reason, even though Brookings has higher in all age groups, we have such a large population of 20 to 29-year-olds that's really pulling our total average down. But we're doing really good in these older ages. I do think it's important to remember, the 70 to 80% needing to be vaccinated for that herd immunity. We're far from that in these younger ages. So anything we can do to get these younger ages vaccinated would be helpful. As far as the U.S., it's acting a lot like South Dakota. It's been stuck at a fairly high rate for quite a few weeks now. 32 million cases, about 500,000 cases a week is what the U.S. is averaging the past couple of months. But the deaths have been going down, 5,000 deaths last week compared to close to 7,000 the week before. But we've had a total of more than 500,000 deaths from this outbreak since it began. And this came out actually this morning in the New York Times. And, we've talked a lot about excess deaths in the past, and last week we talked a little bit about that, and I thought this really shows it nicely over time, over years. These red bars are the death rates, what percent the death rate is above what it normally is in the US. The 1918 flu pandemic, this was a huge pandemic. It caused a huge amount of deaths in the US. And you can see that was about a 12% increase in the death rate at that time. Well, COVID, we're now above 15% greater death rate in the US than we were. You can see these other years where it's been below the years that were above, and then how this current pandemic looks compared to the past, 100 years. If you look at the worldwide, it doesn't look good at all. And a lot of this huge increase is in India, where they're having a really hard time getting this under control. The vaccine program there is behind, and a lot's being done to try to fix that. But we've had about 5 million cases per week, 5.5 million this past week compared to 5 million the week before. But you can see that we're getting higher than it's been. And the deaths are also quite high, over 3 million deaths worldwide from COVID. And the last 2 weeks have been about the same at 85,000 deaths per week, which was a lot higher than what we've seen previously. So the death rates are also going up worldwide. So we will get there, but everyone's going to need to work together on this. So, get vaccinated and follow public health recommendations. Wash your hands, wear a mask, try to stay in ventilated areas, avoid crowds, and socially distance.
Thank you so much for the update this week, Bonnie. For those of you that may have questions for Bonnie and related to epidemiology, please email us at the email address that's located in the description of this video, and we will answer those questions for you. Until next week, bye.